We're going to pick up our story now, part 4, beginning on 370 and 71, where we're going to be taking a look at the first anterior compartment of the leg. But let me go back just one step to the very end of part 3, where I depicted for you the 3 outflowing nerves from sciatic that takes care of the leg for us, the 3 compartments of the leg. Recall that the sciatic divides into the common fibular and the tibial. And the tibial is going to take care of the posterior thigh, but also the entire posterior leg at every level and the foot. So that's part of this program, posterior leg and foot. Over here we have the deep fibular branching off of the common fibular. Deep fibular is going to take care of the anterior leg. And then over here, the superficial fibular is going to take care of the 2 muscles of the lateral leg. Okay, so I need you to sort of pay close attention to this because I'm going to give you a Clemente Atlas moment here of looking at the 2 branches of the common fibular right here. Let's take a look. We have a fairly well dissected anterior and lateral compartment of the leg. And what I need you to notice is that here is the common fibular nerve right here. Do you see it? It's coming from the posterior aspect of the knee. Okay, right up here we have the knee joint. We have the common fibular coming around. It's just about to branch. Notice that we're lifting up a muscle here that's been transected. Okay, it's an anterior compartment muscle. And here we have the division going on. So do you see, first of all, that in this picture, the artery that's serving the anterior leg right here, this is called the anterior tibial artery. It's coming between the 2 bones. It's coming between the tibia and the fibular bone over here on the side, the fibula. And it's well protected, right? So we have a little opening between the 2 bones that this artery comes down through. This is coming off of the popliteal artery, which is coming off of the femoral artery. Okay, so do you see how well protected the artery is? Okay, not so the nerves. The nerves are actually coursing around here relatively superficially on the outside, and they are exposed to what could be described as traumatic injury. And I want you to pay close attention to this because you are becoming clinicians, okay, clinical scientists, which means that if somebody were to have an injury here at this nerve, that means that they would have what we call a drop foot. None of the anterior muscles of the leg would be able to function and dorsiflex the foot. As a result of that, this person would have a hard time walking, and they would have to bring their foot out this way and sort of drag the foot around this way in order to take the next step as they're walking. Not a very, how shall I say, graceful stride. So this is a very important feature of the human body that, you know, I'm sure there are people who would like to shake their fist at the divine for coming up with this design feature here, but that's the way it is. We do have a slightly, how shall I say, exposed innervation right here. The common fibular coming down, this is the deep fibular here and the superficial fibular here. So the deep fibular is going to follow along with the artery, and it's going to serve all of the musculature of the anterior compartment. Okay, so now let's get on to that musculature right here. We've had our little correlation. Okay, so let's come here to the anterior compartment. There is what I would call a Tom, Dick, and Harry going on here. And so here in the anterior compartment is this one right here, the most superficial next to the shin, right here, the tibial shaft. If you were to dorsiflex your foot, lift your toe upward, then this muscle would contract and bulge in front of this shin right there. It's called the Tibialis Anterior. It's coming down. Do you see where it's going? It's just sort of going into the medial aspect of the foot, and we get to flex, dorsiflex the foot upward with this muscle. Then we have a group of tendons right here that are attached to this muscle here, referred to as the Extensor Digitorum Longus. Extensor Digitorum Longus goes to all the toes of 2, 3, 4, and 5. Okay, we do have another extensor right here, which goes to the Holocus. So remember, this is Holocus, not Pollux, the great toe, right here. And so as we come up here, we get Extensor Holocus Longus. Now let's come over here and take a quick look at Tibialis Anterior, where we began our project. The origin is, it says here, on the lateral condyle of tibial shaft and interosseous membrane. It connects by a tendon to the inferior surface of the medial cuneiform of the foot. So we're coming down to the medial aspect of the foot right here. Okay, so that's the idea here. We have the prime mover of dorsiflexion. So when you dorsiflex, lift your toe up, you can do that and sort of feel the musculature in front of your tibial shin shaft right there, and feel how this muscle is contracting. So prime mover of dorsiflexion, or lifting up your toe. And we have the deep fibular. All of these are going to be deep fibular. Okay, then we have what we saw next was the extensor digitorum longus, and basically we're coming out to the distal phalanxes of toes 2 to 5 at the extensor expansion right out here. So these are those tendons right now. You'll notice we also have an extensor digitorum brevis, which is a little bit deep and below that, not coming quite as far. Okay, let's take a look here. We have the prime mover of toe extension, acts mainly as a metatarsophalangeal joint, a dorsiflexor of the foot. Remember, that's right here. That's this set of knuckles or joints right at that level. Okay, deep fibular nerve. Then we have the extensor holocus longus. Remember that the great toe is referred to by the name Holocus. Maybe that's your first son's name. Your second son's name is Pollux. It's hard to know these things. So the the anterior fibula is where we begin, the interosseous membrane, and we go all the way down to the distal phalanx of the great toe, and we extend the great toe. So that's this little number right here, and that's all I'm going to present in this picture. It's a straightforward Tom, Dick, and Harry. Tom being tibialis anterior, and Dick being the digitorum, the extensor digitorum, and Harry being the extensor, holocus longus. So easy, Tom, Dick, and Harry right there, just the way you like it. Alrighty, then we're going to move on to the lateral compartment. Remember, the lateral compartment is innervated by the superficial fibular nerve. Over here we have, let's take a look at it, fibularis longus and fibularis brevis. Just two muscles in this compartment, only two, and basically both innervated by the superficialis nerve right here, superficial fibular. And we're going to be, first of all, we're plantar flexing because we're going behind the lateral malleolus and we're pulling down on it. But the interesting thing here is the insertion. The insertion for the, over here, the longus versus the brevis The longus is going to go all the way across the bottom of the foot over to the first metatarsal in medial cuneiform, whereas the brevis is going to go just to the fifth metatarsal. Let's take a look at that. We have these two muscles right here, and they're coming down and they're going behind the lateral malleolus of the ankle. Are you with me? And one ends right here on the fifth metatarsal. The other one takes a dive, and it goes all the way across the bottom of the foot to the first metatarsal. Quite astounding. Okay? So I need you to understand that we have these really interesting muscles right there, and they're using this as a lever, and one is going all the way across the bottom of the foot. So take a look at that in your text.